Okay, so now that we've talked about pathophysiology and sickle cell anemia, let's visit some complications, okay? And so in complications, we're going to talk about signs and symptoms, and we'll talk about preventing that complication or those sets of complications, and we'll talk a little bit about diagnosing. Okay, so first, I like to break up signs and symptoms of sickle cell anemia into two categories. One being a general type of category, and the other being a more specific complication category or signs and symptoms category related to sickle cell anemia itself. So, excuse me. First thing here, let's make some comparisons. So, here's a normal, and here is SCA, which represents sickle cell anemia. So we know that if this is distribution of red blood cells in an individual, these are my round, healthy, happy, normal red blood cells, right? And I know that round, happy, healthy red blood cells, they all carry oxygen. So what I'll do is I'll make a line on each one of these, and that represents these cells carrying oxygen. Okay, now I can do the same thing in sickle cell anemia and in this pattern that I have here. So I have happy, healthy red blood cells here, so I can mark those off. But in addition to these happy, healthy red blood cells, I have some sickled cells that's taking up some space. Now, these crescent-shaped, abnormal red blood cells don't carry oxygen, so they're not going to get marked with the white line. And so here's the issue. I have a normal saturation of happy, healthy white blood cells here carrying oxygen in my body. And here, I have an uneven distribution because I have some happy, healthy red blood cells, but the rest are abnormal. They're mutated and they don't carry oxygen. So what are some of the common signs and symptoms that I'm going to end up with? Well, these would be general symptoms that we would also see in other types of anemia. A common one being fatigue, right? Dizziness and pallor. These are really common things that we're going to see in anemias, and you'll see it also in sickle cell anemia. Now, the fatigue is related to decreased oxygen. Dizziness related to decreased oxygen, and pallor related to decreased oxygen. So you see that this is kind of a general overview of what happens when you don't have enough oxygen circulating in your blood. And overall, this is the same thing that you're going to see in other type of anemias. So all of these are related to decreased oxygen in the blood. Now, sickle cell also has something else that's pretty specific to itself. So here I'm going to draw an image of a microvascular system. So here's microcirculation. And by micro, I mean capillary, right? Now, let's give ourselves a scenario. So let me come here, and I'm going to draw this out here, and let's pretend that this is my arm. Let's pretend even it's my anacubital space if you want to. So here's my arm. And this is capillaries that's running in my arm. So I've kind of just zoomed in on one specific capillary. We know that in normal blood flow, what should be happening is we have these happy, healthy red blood cells circulating in my capillary system or my microvascular system. And again, we'll mark those off because we know each one of those carries our oxygen molecule. And so this white's going to represent O2. Now, if we throw some sickled cells in the mix here, what happens? And if you notice with my drawing, I have these cells clumped together. And that's the reality of the situation. We know that sickle cell, that they're stiff and that they're sticky. As a result, they bind to each other and they bind together. And if you can tell by this point right here, I have now created an occlusion, meaning a blockage. So up until this point, these red blood cells in my microcirculation have been delivering oxygen to the surrounding tissues, right? And so now I get to here, to my occlusion, and there's going to be no oxygen being delivered at all to the surrounding tissues. And so we'll make blue X's to represent that. And so what's going to happen as a direct result? A big hallmark sign, pain. Now, this type of occlusion that we see in sickle cell anemia is known as a vaso-occlusive crisis, or a sickle cell crisis. Okay? Hallmark sign is pain. In any situation where we don't have oxygen being delivered to our tissues, we experience pain. Hallmark sign. So, how can we prevent this? Is there ways that we can do some kind of prevention? Well, there's a couple. Increase hydration. We know that when we are adequately hydrated, our blood flows smoother and a little bit faster. When we're dehydrated, blood flow tends to slow down, and that's going to lead to increased sickling. Rest, okay? Increase rest. So if we're talking about someone that might be an active person, increasing rest is important. We know that when we are very active, we are increasing the need for oxygen consumption. So in a situation that we might be increasing the need for oxygen to be consumed by the body because we're very active, resting in between is going to help. Another way we can help prevent these symptoms from occurring, or these complications from occurring rather, would be to decrease scenarios where we are in low oxygen areas. So elevated areas, right? Or we travel somewhere where there's low O2, we want to be careful with that. Now, when we talk about diagnosing sickle cell anemia, it's pretty basic. The diagnosis is done with blood. So blood to diagnose. Most newborns, they're screened at birth for sickle cell anemia, and what they're looking for is the presence of hemoglobin S. If there is in fact hemoglobin S present in the blood, we know that this individual is positive for sickle cell anemia. Another way we can test is by doing genetic studies on an individual, and this way we can look to see if someone carries the sickle cell trait. And that's important because we know that if an individual carries a sickle cell trait and procreates with another individual that has a sickle cell trait, there is a chance that they can have a child with sickle cell anemia. So these are some common things that we'll do to diagnose. Now, these are pretty basic in and of itself. All right, so we talked about some general signs and symptoms that we'll see, some localized or specific signs and symptoms that we'll see, some things that we can do to prevent the complications, and how we actually diagnose. So the next thing that we'll talk about in our third video is going to be about treatment. All right, talk to you soon.